And last but not least, we have Paul Moulton from Isle of Man Television. Good afternoon, Paul. Fast am I.
Thank you. For Dr. Allison, you said there are no hub schools, yet I've been told that there is a hub school in operation down at the NSC for health workers. Can you comment if that's true, or is that just a complete rumour?
No, you have wonderful sources, Paul, and I'm always in awe of what you learn. We don't have a hub school. No, we have a childcare facility. One of the things that was quite evident over the last couple of weeks was the strain that this outbreak has caused for Nobles Hospital. You're aware of that in terms of the increasing numbers of people coming into hospital, but also quite a large amount of staff who are having to self-isolate because they've been contact traced, but also those people who couldn't access childcare and so couldn't come into work for that. So what we've done in terms of the department is set up a facility so that we can provide that childcare for those critical workers, those people working, for instance, in intensive care, who need that so that they can go and do the job that we all rely upon. And so we will be doing that over the Easter period to support those critical workers. And we are in conversation with some of the other frontline staff as well, so that if we need to, we can provide that so that they can go to work.
And you can understand the angst amongst other people who believe themselves to be frontline workers who can't get into this system at the minute.
No, absolutely. We are trying to do something at a very difficult time in terms of risk assessment. One of the reasons we've used the NSC is because the high ceilings, the ventilation, really using very, very small groups who are kept together right the way through. So if there are any outbreaks, they can be dealt with. One of the things that the Council of Ministers did last week was allow people to join in terms of households for childcare, particularly for people who were single parents. We've also provided childminding facilities for those critical workers. So we're doing as much as we can to support people who really have to go into work. But we are still in the position of asking people, if you can, please stay at home. Only go into work if it is really essential. We will get there, but we need to do it in stages, as the Chief Minister has said.
And my second question, we're probably not the hottest ticket in town this afternoon. I think listening to Dr. Rachel Glover giving her account to the PAG committee is dynamite, and I've only been listening up till the start of this press briefing. But one of the points, and it has been sort of said before, and I think this is quite worrying for a lot of people, is that certain people were giving information to Comin who maybe shouldn't have done it, maybe above their pay scale, or they weren't slightly qualified enough to make advice. Do you accept that has now happened, because this is not a new allegation, Chief Minister, and the rest of the panel, please? And are you looking at that again because you may have got information that wasn't necessarily signed off by the right people?
Well, I haven't heard the evidence, Paul, so I'll have to wait and see the report from the committee. That's been said. That said, we have a consultant who's, in my books, is higher than a doctor, that's been advising the Council of Ministers on genomics and our testing setup. But let's see what evidence has come, and then we can make a statement on that. I think David will no doubt want to come in on this. David.
Yeah, thank you, Chief Minister. Obviously, I haven't heard the evidence session. I'm sat here with, like you are, Paul, with this, so I haven't heard any of it in the terms you've put it. So I will have to listen back to the evidence session to see what was actually said. But in the terms you've put it, no, I don't accept that. I think the officers who've been advised in Council of Ministers are qualified to do so. And one of the reasons that we have the chains, so it's not just a case of anyone can come and advise Council of Ministers. There is protocols in place where any advice to Council of Ministers goes through various chains, and that's exactly why that's there, to ensure that it's been double-checked, treble-checked, and that the advice that's given to Council is right, correct and proper.
So there's likely we'll be talking about this on the next one on Tuesday. I'm sure there'll be other questions that you can clarify from this evidence that's been given today.
Well, like I said, I need to hear the evidence session first, Paul. I'm great at multitasking at and doing things, at the same time, but I can't quite do a press conference here and also listen to a Tynwald evidence session at the same time. That's
shocking. I thought you'd do better than that. No, I'm joking. Thank you very much.
I'm disappointed in myself.
We'll talk next week about that. Thank you very much.